Good afternoon, everybody. Happy Leap Day. We are moving through our Leap into Learning webinar series. So this will be our second webinar today. We just finished up with GTL and Michael Gendy. He taught us some pretty cool things about how simple it is to cross-sell GTL's product. They're very easy to use consumer-facing videos. And then their Fill the Gaps tool, which really kind of takes the guesswork out of selling a hospital indemnity product. Up next, we're going to have Trina Gilbert from Physicians Mutual. She is going to talk about their innovative Medicare supplement plans, as well as their dental plans. So she's going to fill us with some more information. And these things are all in preparation to get you guys a little bit more well-rounded in your product offerings. We have found that the more products an agent has within a home, the less likely those clients are to ever look for another insurance agent. So this will just help you balance out your book a little bit. It will also help you keep the longevity of your business. So Medicare enrollments, you know, those hang in there. They really do. They don't typically bounce from plan to plan. But once you start adding Medicare or ancillary products to those Medicare plans, that book really doesn't go anywhere. So I think you'll find all these webinars very informative. You can chat in your questions at any point. We will definitely make sure that we get any questions answered for you. And we're going to start here in just a second. Miss Trina is having some technical difficulties, so just bear with us. We will be very respectful of your day and your time. All these webinars are also going to be recorded, and we'll have those posted as soon as possible. So just please bear with us, give us a few more minutes, and I'm sure Miss Trina will be on as soon as she can. So we have, we're going to use some brochures, and these are the Physicians Mutual brochures. Again, I have, well, I don't have patience, I guess is the way I should say that. So I want to get you guys started. Want to make sure that we give you as much information as possible. So Physicians Mutual, they have a full slate of products, but the key products that they offer that set them apart from other carriers are their dental plan and their innovative Medicare supplements. Their innovative Medicare supplements really, they're patented, first of all. So Physicians Mutual is the only carrier that can offer the innovative plans. And they can offer those in multiple states. So if you're not sure whether or not your state has an innovative plan available, please reach out to a member of the National Contracting Center staff or Physicians Mutual. We can give you that information. But most of our key markets, those plans are going to be available. And what an innovative plan is, in a very brief sentence, is a Medicare supplement that starts out as a high deductible plan and then turns in to a normal plan G about 3 years in. So at the end of that second year coverage, you get the benefits of a normal plan G versus that high deductible plan that you had for the first couple years. So you'll see here on this part of the brochure that this talks about people who are Medicare eligible on or after January 1st, 2020. And the big difference with that is the type of plan you're eligible for a guaranteed issue onto. So if you're eligible before 1/1/2020, then you're going to be eligible for a Plan F. If you're eligible for Medicare after 1/1/2020, you are going to be eligible for a Plan G. And the biggest difference in those two plans is whether or not you're paying a Part B deductible. So we're going to go into this assuming that everybody we're talking to is eligible after 1/1/2020. So we're going to just revolve this particular conversation around Plan Gs. And on a Plan G, you do pay your annual Part B deductible, and then everything else is taken care of for you, except in the case you would have a high deductible Plan G or an innovative Plan G. So on a high deductible Plan G, you have a plan deductible of $2,700. That $2,700 is in addition to your annual Part B deductible. And once that amount is hit, the plan pays everything. So the exclusive innovative Plan G starts out as a high deductible Plan G with that $2,700 deductible. And on the third plan year, goes to a normal Plan G. So after that on that third plan year and thereafter, you don't have to worry about the $2,700. You're only paying your annual Part B deductible, and then the plan will pick up the rest. Now you're probably sitting there asking yourself, well, what's the benefit of that? Well, the benefit of these innovative plans is the cost is lower. So during your first 2 years of coverage, you have a high deductible Plan G, which means that Physicians Mutual doesn't have as much risk as what they would have on a normal Plan G. So their plans start out lower cost, and they're able to maintain those costs through a longer period of time. So there's typically, $75 to $100 difference by the time you're in your 70s on an innovative plan versus a normal Plan G with Physicians Mutual. So it's a great way to have Plan G coverage on a cost that is not as high as Plan G with an innovative plan. So that's the whole motive behind that. Physicians Mutual has really done their due diligence with this plan to keep those costs down, and that has worked wonders for them. They're really getting a lot of traction on their innovative plans. It's a great way to offer a Medicare supplement to somebody who may not have been able to afford it before, but need it because of their health concerns. So this is just another option to have in your pocket, especially if you're an agent who is selling a lot of Medicare Advantage plans and seeing some more low-income clients. The innovative plan is nice to have in your toolbox per se, to offer to your clients who might need more robust coverage due to their health concerns. We have finally got the PowerPoint, so I don't have to ad-lib as much. Brandon's going to put that up for me, and we'll go from there. But if you all have any questions, please let me know. I'll do my best to address them. Okay, this is another part of their innovative plan. So all the preventative care is at no cost, even on an innovative plan. So that is not a cost that you're going to incur throughout that high deductible period. Anything that is considered preventative does not charge on an innovative plan. That's a big deal. So you can see on the slide on the left the frequency. So you can get pretty much anything done, including depression and diabetic screening, colonoscopies, flu shots are going to be free. Diabetic prevention programs could be at no cost. So there's a lot of different options there that will charge through other plans, but are not going to charge through that high deductible period or any period with Physicians Mutual innovative plans. Okay, these are just some additional preventative, as Physicians Mutual calls them, lifeline screenings that are available at no cost with the Physicians Mutual innovative plans. So this thermal imaging is pretty cool. This is a much more technological way of detecting cancers in people. So it can be used as a monitoring tool. It is also something that is considered preventative with Physicians Mutual. So you can see it comes at a pretty big cost normally. And that is not going to be something that Physicians Mutual clients have to worry about. This is covered as part of that preventative package. So you can have the thermo imaging at no cost with the Physicians Mutual plan. And here's that pricing that I was talking about. So if you're a 68-year-old on an innovative plan, you're typically paying on average of $125. A normal plan G would charge around $107 or $157. So that's an annual difference of almost $400, $385 in annual difference from an innovative plan to a normal plan G. So that does make a huge difference in affordability. It also makes a big difference in how long a client can keep a Medicare supplement. So a lot of times people will get priced out of their Medicare supplement. With a Physicians Mutual innovative plan, that doesn't happen as quickly. It may still happen, but it doesn't happen as quickly. These are obtained age products versus issue age. So the plan is rated based on when the client signs up, not when the plan is issued. So Silver and Fit, it's a big option for our clients, and that is available through all Physicians Mutual Medicare supplements, including their innovative plans. Okay, and these are some additional states, including Florida and Georgia, where the preventative care is going to be part of that package. So because Physicians Mutual does offer additional benefits that a lot of Medicare supplements do not, these products are only in certain states. The same as, not the same states as their innovative plans, but the same situations. So please let us know if you have a license or you are currently selling in a state that is not listed on the screen, and then we will let you know whether or not the preventative and or the innovative plans are available within that state. So this is pretty cool. The 2-year selection guarantee means that within the first 2 years of owning a Physicians Mutual policy, you can switch to any of their plans up or down in coverage without underwriting. So if you were to start on a plan N and decide that you really didn't like the copays, you don't like the plan N coverage, you could go to a plan G within those first 2 years without any underwriting. That's available to first-time buyers of the Physicians Mutual family. So if you're 70 and you go on to a Physicians Mutual plan N, and at 71 you decide you really like your plan G and you want to go back to that, you can do so as well, as long as you're within your first 2 years of owning a Physicians Mutual Medicare supplement. That's something you don't see with any other carriers. So that 2-year selection guarantee will allow you to increase or decrease your Medicare supplement policies without any additional underwriting. And now they're dental plans. So Physicians Mutual Dental has been talked about for a long, long time. And for a long, long time, you couldn't sell Physicians Mutual as an independent broker. Now that Physicians Mutual has opened to independent brokers, you can absolutely sell not only their supplements, but also their dental plans, as well as any other plans within the Physicians Mutual family. What you can expect from every dental plan that Physicians Mutual offers is 100% paid preventative care when you use an in-network dentist, immediate benefits for preventative and basic care. Major benefits will start after 12 months. That is not at all abnormal. There is no deductible on a Physicians Mutual dental plan. There are also no annual maximum on cash benefits. So that the Physicians Mutual dental plans are going to be some of the most robust that you're going to find out there. They do have 4 different plans to help you cover the same 400 plus procedures. Those 4 different plans will allow you to tailor plans based on your benefit, or based on your budget, I'm sorry. For an example, here you'll see 3 different examples. Preventative treatment is going to pay at 100% across the board on all 4 plans. Your basic treatment is going to go up and down depending on your plan. So that economy plan, it's going to be the cheapest. It's also going to have the least amount of basic coverage at 25%. But if you're able to afford the premier plan, you're going to see a coverage of 70% with the basic treatment. Also 70% with major treatment, including root canals and crowns on that premier package. On the economy, you still have 25% coverage, but some coverage is better than none. You can see all the states that these products are available in running across the top of your screen. Those are all of our major markets as far as where our agents are actively selling with National Contracting Center. If you offer in a state that is not listed, please give us a call and we'll tell you some other options that are available to you in those states. Physicians Mutual dental products are also going to cover eye exams up to $100 per person per year. They offer vision correction and covered hearing exams. These are available as a rider at just $8.95 per month. They will also have vision discounts. So for things that are not covered, you can get 20% off of a comprehensive exam, 20% off of glasses, 15% off contact lenses, and then 15 to 20% annual savings off of laser vision correction surgery. I will tell you that as somebody who wears contacts, I have looked into LASIK, and it is rare to find a plan that covers them at all. So that 15 to 20% discount is a great option as a rider on a dental plan.
Courtney, we had a question come in. What were the ages for the dental plan?
It's 18 and up.
18 and up. Okay.
Brandon, if you'll go to the next slide for me.
Yep.
Okay, so we're testing our vision skills now with this rate chart, but it is really affordable. So you can get the plans as an individual and spouse, one parent and children, or the entire family. And you can do that at any age, ages 18 and up. So it looks like the plans are going to start around $30, and they can go up to about $56. And those are individual plans. If you're talking family plans, you're looking at like a $96 to $180 range for those plans, and those are monthly payments. They can be broke up into quarterly, semi-annual, and annual. If you have their dental plan with a MedSup, you do get a discount, and it looks to be about 15%. So that dental plan would go from $30 down to $28. So nice little drop there. For a dental and vision, just the baseline dental product, their Vision Rider and a MedSup, it's only $37 per month. If they do not have the MedSup, if they're under 65 or have coverage elsewhere, that dental with the Vision Rider base products would be $39.45. So very affordable products. Most people don't blink an eye as long as the cost is under $50. That's also where we see the highest product persistency, is those plan premiums at about $50 or under per month. Okay, so this is an example in 3 states, Massachusetts, Nevada, and Virginia, which are some crazy interesting states as far as what they will approve. And this is what the Physicians Mutual benefits will break down to. So there's over 30 preventative benefits that start immediately, including the comprehensive exam and bite wing x-rays, along with the cleaning. And those are all at a very normal cost across the board in those 3 states. Those are states that aren't going to approve that preventative being covered at 100%. In states that have the preventative covered at 100%, you would not have to worry about these costs. And again, there's no annual cash value on these, annual maximum cash value on any of these plans, even in states that don't have the preventative covered at full cost. Their eye exam riders are going to be a little bit different in those 3 states as well, but they will cover $50 per person per year instead of the $100. They do still have the vision correction benefit, which includes prescription eyeglasses, sunglasses, and contact lenses. The first year, it's up to $50 per person. The 3rd year and beyond, it's going to cover at $150 per person. And then at no additional cost, you're going to get the 20% off of a comprehensive exam, 20% off of glasses and lenses, and then the 20% off of LASIK surgery, off of the laser vision correction as well.
That's the last slide there, Courtney.
Oh. So in typical Courtney fashion, I fly through things pretty quickly. If you do have any questions, please do not hesitate to reach out. We do want to get you as much information as possible. I cannot apologize enough for the technical difficulties that we had with Physicians Mutual. I know Miss Trina is not happy she was not able to join us. But if you have any questions at all for Miss Trina, her email is pretty straightforward. It is Trina, Trina, .Gilbert, GILBERT, at physiciansmutual.com. And we'll get that email out to everybody who joined us for this session as well. She can also be reached by phone. She is crazy responsive on her phone, guys. Don't hesitate to call her. Call or text at 205-970-4145. So you can call, text, or email Miss Trina. She is extremely helpful. She loves her job and the benefits that Physicians Mutual offer. I did not do them anywhere close to justice that she would have done. But please remember, they have a patent on their innovative plans, which start out at a high deductible Medicare supplement and then go to a normal Plan G after the second year. You also have that 2-year policy guarantee where you can change plan to plan with Physicians Mutual, and their dental plans have no annual policy maximum. So those are the 3 big takeaways with Physicians Mutual. If you have any questions, again, please don't hesitate to reach out to a member of your sales development staff at National Contracting Center, any member of our training staff, or staff in general. We are all here to help you along with our carrier partners. Up next, we have Medico starting at 1 p.m. Eastern. So we will get this session wrapped up. We're going to jump over to the Medico section. They're going to go over their short-term care plan, which is brand new to the market, as well as some of their other product offerings. So thank you for joining us and bearing with me while we got through Physicians Mutual. Please let us know if we can do anything else for you.